Black. Go ahead.
Okay. So my presentation is on Helicobacter pylori bacteria and ulcers, also known as H. pylori bacteria. It's the common cause of gastritis and peptic ulcers, and it increases the risk of developing stomach cancer. It's estimated that about 1/2 of the world's population is infected with the bacteria, and it is declining in the United States, though. About 20% of people under 40 have it, and over half of the population over 60 has it. However, most people that have the infection do not develop ulcers, so it's thought of that maybe some environmental factors also contribute to the development of ulcers, such as maybe the individual characteristics of the person, abnormal immune responses in the stomach, and also certain lifestyle habits such as people who drink coffee, who smoke, or consume alcohol. This is a picture of the gram stain of the bacteria. It's a bacilli spiral shape. It's gram-negative, and it belongs to the Helicobacter genus. When it was first discovered in the 1980s, it belonged to the Campylobacter genus, but then after later research, it was placed in its own category. The infection resides on the mucosal lining of the stomach, and is able to survive the acidic environment in the stomach by secreting enzymes, the urease enzyme, which creates a low acid buffer zone, allowing it to burrow its way through the stomach. Also, another thing that kind of allows it to survive is that the T cells by the body's immune system, it's difficult for them to get into the area of the stomach to fight them off. And this is a biopsy of the epithelial tissue. The picture on the left here is the one that is infected with the bacteria, and then this is a normal tissue sample. Symptoms of someone that has the infection, the main symptom is abdominal pain, nausea, vomiting, burping, bloating, weight loss, and poor appetite are also symptoms. And there are 4 major complications that come along with this infection. Perforation occurs when the ulcer burrows through the stomach wall. Bleeding happens when the acid or ulcer breaks a blood vessel, and it can cause bleeding in the blood in the vomit, and it can look like, I guess, coffee grounds when someone's vomiting. Obstruction happens when the food exit from the stomach is blocked, and then penetration of the ulcer can occur through the bowel wall, causing leakage of the luminal contents into the peritoneal cavity, which covers the organs. The exact causes of someone developing this bacteria are unknown, but it has been linked to direct contact through saliva, also oral fecal contamination, and possibly through water. And the bacteria is also more prevalent in underdeveloped countries and is usually contracted during childhood. Not all ulcers are caused by H. pylori bacteria. A lot of them are also caused through use of NSAID medications such as aspirin and ibuprofen. So once an ulcer has been found, then tests are done to confirm if someone has the bacteria. A blood test can be done, usually by a finger prick to check for the antibodies. Then a breath test is another test that's used. A person would drink a solution that contains radioactive carbon molecules, and if there is an H. pylori infection, the radioactive carbon is released when the solution is broken down in your stomach, and your body absorbs this carbon and expels it when you exhale. So the person would exhale into a bag, and the doctor would use a special device to detect the radioactive carbon. A stool test can also be done. It's a lab test called the stool antigen test, and it looks for foreign antigens that are associated with the H. pylori infection. An endoscope test is also used. It's pretty invasive. They use a flexible scope and put it through the person's mouth, and it goes down into the stomach. And the doctor can view any irregularities and also remove tissue samples and do a biopsy that way. It's used to diagnose an ulcer and then also to test. As far as treatment, it's pretty rigorous treatment. The 2-week triple therapy treatment is the most common. It's where you take 2 different sets of antibiotics in order to overcome any resistance that the bacteria might have to one of them. And then you would also use like antacids to treat the symptoms of the ulcer and help that heal. It prevents ulcer recurrence in more than 90% of the patients. But I do have a friend who was recently hospitalized for esophageal ulcers, and she underwent this treatment and it didn't get rid of her bacteria. So it's not successful in everyone. But then a follow-up breath or stool test is used to determine success of eradicating the bacteria.
Okay.